Hey you guys, Maria here, and today I want to talk to you about advocating for your own health or the health of a loved one. So a little bit about my backstory. I am actually a radiation therapist, so I have worked in a cancer center now for almost 9 years. The irony of my husband being diagnosed with cancer so young and having the profession that I do was just unbelievable. So when Nick was first diagnosed and we first started noticing his symptoms was when I was giving him a massage one day. And I had felt his supraclavicular nodes just a little swollen, so the nodes that live right in here. And I had remembered from school that when these nodes are swollen, these ones in particular, 90% of the time it means that there's a cancer diagnosis behind it. So imagine how freaked out I was after that just simple little massage. The nodes were really, really tiny, but I still made Nick get an appointment with his primary care physician the very next day. So on that day, I went with him just to make sure that we were getting clear and concise information. And when we arrived there, basically the physician kind of felt around, wasn't concerned at all, and just laughed it off. She said, the chances of this being cancer are so tiny, and you work in a cancer center, so that would just be way too ironic, and just laughed it off and said, he's fine. And that just didn't really sit well with me, because one of the key things that I had promised myself working where I do is that if any of my family members had a suspicious symptom, I would never ignore it. It has been very important to me to make sure that anyone that I'm close to and that I love will follow up with concerns that they have. So at that point, I said, I know that it's possible we're overreacting, but we would really like some additional tests. So what happens after this? And she said, he can get a chest x-ray and some blood work. So we went ahead and did that, and everything came back normal. So over the weekend, it just still didn't really sit well with me. And she said, if you're really concerned, we can get you a referral to a head and neck surgeon. So on Monday morning, because his original appointment was on a Friday, he called and said, my wife would really like me to get that referral to the head and neck surgeon. So 2 weeks goes by when he can finally get in to see him, and he has a few more nodes popping up on his neck that you can't really see, but you can kind of feel them, and they're really tiny. And the head and neck surgeon finds one that he's like, this is the borderline size that I'm willing to biopsy. And the biopsy comes back and it's positive for Hodgkin's lymphoma. So that's kind of the end of the story there. But my point is that if you ever feel like something just isn't right, like something's weird, something's off, you feel something funny, or you're feeling yourself just different, and your primary care physician isn't willing to get you a referral or do any tests, just make sure that you keep a well-documented list of symptoms and dates associated with them. So that way, that if anything changes in your condition, that you have written down accounts of what changed when you go in to see your primary care physician, and you'll have a higher chance of getting moved on to a specialist. Primary care physicians are great. Most of the time, what they see and the symptoms that they get winds up being nothing. But specialists only see people when it ends up being something, so their focus is so narrowed. So anytime that if you're really incredibly worried and you get to see a specialist, they're gonna know more on that particular disease that you're concerned about. And so they can stifle your fears or, confirm your diagnosis better than a general practitioner can. So that is my tidbit of advice. I hope that it helps you out and that you can pass that along, and I'll see you next week.